the three main takeaways are, on one hand, there are fairly serious threats to Medicaid, which is the main federal and state health insurance for low-income people, as well as to safety net programs that help provide services to people across the country. In the American Health Care Act, which is the proposal to repeal and replace the Affordable Care Act, there are very deep cuts that are intended for the Medicaid program. The Congressional Budget Office is estimating that after 10 years, almost a fifth of the people who are enrolled on Medicaid wouldn't be enrolled anymore, and that in addition, about 1/4 of the budget would be reduced. So these are deep and unprecedented cuts that will limit the ability to help low-income people get the types of health care they need. In addition to this, there are a number of other things, structural changes in Medicaid, this notion of creating either a per capita cap or a block grant that will change the dynamics of Medicaid, and on one hand create more flexibility for states, but at the same time create an entirely new set of fiscal risks for them that, effectively speaking, will transfer cost and risk from the federal government to the states. Some of the states may be able to cope with this, while others will have serious difficulties. So for aspiring health policy professionals, this is an exciting time. On one hand, this is a point to sort of be aware of the changes, to try to get involved and understand them and to work on them. At some later point, we will be living with whatever the result is, whether this law is passed or not. There'll be all sorts of things that will be necessary to implement changes in an equitable and just and progressive fashion. And so there's still a tremendous cause for people who want to, in the future, continue to work in the government, work in the private sector, continue to do research in this area. It's one of these things that is ever interesting and evolving. But you do have to realize that in these public policy areas, there are times when sometimes policies will be moving in directions you like, and at other times moving in directions that you don't like. So you need to be flexible in considering that and be aware that they're both ups and downs.